So we're going to talk about inflammation and pain and an orthopedic approach to lower these and sort of a more of a holistic approach. These are our objectives. So we're going to keep it simple, focus on the what, why, and how. So we want to recognize what factors impact orthopedic health and recovery. We're really talking about if you have an injury, a surgery, if you've had a surgery, or even prevention for some of these things, why this matters, and discover ways to sort of help decrease pain and inflammation. So what is orthopedic integrative health? And I think this is sort of the biggest question that people may have. It is kind of a new field, and it's beautiful because it's a synthesis of evidence-based medicine. And evidence-based medicine is medicine that has science and research behind it. So if you look at the little rings and follow my arrow here, self-care is a big piece, as well as conventional orthopedic care and some aspects of complementary medicine. So it's a combination of what we call lifestyle medicine, integrative medicine, and sort of putting the two together to give you the best chance to succeed. And it's really a neat field because it's empowering people to take care of themselves and to do better and not be dependent on pills or procedures or other things. So why does it matter? Why are we even talking about this? Unfortunately, as many of you may know, the leading causes of disability in our country are low back pain, musculoskeletal causes, and neck pain. They're actually in the top 4 causes. And that's true worldwide too, especially for low back pain. So this is a real issue. 80% of people are going to have back pain at some point in their life. And that's not even talking about neck issues, joint issues, or arthritis. So whatever we can do to prevent that and also to lower its impact on daily function, that's really our goal. So these are the factors. These are sort of traditional lifestyle health factors. It's nutrition, movement, sleep, stress, and even relationships. These impact pain and inflammation. And I like to think of it sort of as a missing puzzle piece. That's what integrative orthopedic health is. And it's that last piece that sort of helps optimize your care and give you the best chance at feeling good and recovering. So this is a really busy diagram, and it's something I go over with patients when they come to see me. But I really want you to focus on this sort of green circled aspect on the left. These are the factors that really impact orthopedic success or not doing as well. And the first part is the nutrition, how active someone is, their stress levels, some of their medications, their sleep, addictions. And this doesn't actually mean medications. It could be to food, it could be to social media, it could be other knowing behaviors. And if you feel lonely, and there's a lot of data on how not being socially connected actually results in more pain. And so our goal is to sort of make an intervention and help with these things before they start to affect the body and cause more cellular stress and injury, and then lead to more inflammation. So this is just a little cartoon. It's kind of fun because this is sort of what typical conventional medicine is, right? It's chasing symptoms, it's passive treatments, it's pills, it's procedures. And the line for this kind of thing is not really there. And I don't think that's anyone's fault. I just think it's because it's not widely available or talked about. But there's a lot of things we can do to empower people to feel better on their own and with orthopedic care as well. So we'll start with nutrition. We always start food first. And the standard American diet, unfortunately, is sad. So more than 90% of US adults report that they have intermediate or poor healthy diet scores as found by the American Heart Association. And the SAD diet is really weighed down with a lot of sugar, excess salt, unhealthy fats, and a lot of artificial ingredients and colors. And it really lacks vegetables and fruits. And unfortunately, what happens with that is it promotes more inflammation, which inflammation, just to be clear, is more swelling and pressure on the joints and spine. It's more pain. It increases the recovery time from painful injuries. It leads to more painful flare-ups. It increases fat mass and decreases lean body mass. And once again, these are all evidence-based statements. So the standard American diet causes more inflammation, which we talked about causes more pain. So what can you do about it? This is data from an article taken in JAMA, which is a journal of American Medical Association. It's a very reputable medical journal. And there's really ways to grow your health span. So this doesn't just help with your orthopedic health, but it helps with your overall health. Some of you may have heard the term lifespan, and that means the number of years lived in health. Healthspan is the number of years, lifespan is the number of years lived. Healthspan is the number of years lived in health. And that's really what some of these things can do, some of these changes we're talking about today. So increasing vegetable and fruit intake, increasing nut intake, whole grains, omega-3s, and increasing physical activity while reducing excess sodium and really maintaining a healthy weight. BMI isn't always the best measure, but a healthy weight for your body type. This is a really cool study. So this was actually a study looking at the effect of plant food and arthritis on the joints. And they found that an increased diet of polyphenols and phytonutrients, those are the things that give plants color. They're their protection and their strength. And you may have heard the term, eat the rainbow. And the reason that that is said is because each different color provides you with some different nutrients. And so phytonutrients act as antioxidants and they help limit inflammatory damage. Examples are blueberries, turmeric, green tea. And the study actually found that increasing these types of foods leads to less oxidative damage, less cell death, and actually can increase some joint strength and lay down more collagen. This can lead to less arthritis, less pain, and less inflammation. So again, even if someone has arthritis or some pain issues now, these measures can help. And if you don't have them, these can be somewhat preventative too. So it's kind of a win-win. This is a famous pyramid, sort of a healthy food pyramid. This is Dr. Andrew Weil's anti-inflammatory diet. It's really similar. It's almost cousins with the Mediterranean diet, just with some small tweaks. The bottom line really is the bottom of the pyramid, which is more fruits and vegetables, and getting that phytonutrient benefit, which helps with inflammation. These phytochemicals act as antioxidants, anti-inflammation, they help the immune system, they help with blood sugar and hormone control as well. And there are some treats at the top, it's just everything in moderation. This is the actual Mediterranean pyramid. This is one of my favorite ones of it because it actually adds the other aspects of what we talk about in integrative medicine as well, which is physical activity and social connection. So those things matter too, and it's really a whole healthy lifestyle. And so some patient tips, because that's sort of our topic today, is to focus on foods that are high in phytonutrients, high in fiber, high omega-3, and try to limit processed food as well as added sugar. Natural sugars, like in fruits, aren't as bad. It's more the added sugars. There is actually data for intermittent fasting, or what I like to call a limited eating window, that it can reduce pain and inflammation as well. This is another resource in terms of tips that we're trying to give today. It's myplate.gov is the website, and it's the national recommendations for a healthy diet and food. And so there's a lot of good information there, the website right down here on the bottom. And you can see with the plate diagram, it's half the plate is vegetables and fruit, more vegetables than fruit. And that's really the major aspect of it. And ways to afford fruits and vegetables if that's an issue is to do seasonally fresh vegetables and fruits, or even frozen, can be helpful too and more economical. So moving on to movement. So there's no age limit on the benefits of exercise, right? It can help everyone no matter their age. Most people are capable of some movement, even if you modify. It actually helps with muscle mass. It helps decrease frailty. It lowers risk of dementia and fractures. It helps with many diseases. It also helps with sleep issues. And what we're talking about today is degenerative changes, as well as bone thinning. So there was a recent study that came out in the Spine Journal, and they were talking about longer sitting and lower physical activity is associated with more chronic back pain in people over 50 years old. So it's about exercise, but it's also about more frequent movement, and that matters as well. This is just a nice visual we put together. The top is really the key part. So what are the benefits of activity and movement, and how do they decrease painful inflammation? So they actually release endorphins, which are natural opioids. They help activate the endocannabinoid system, which is actually the receptors for medical marijuana. They improve mood, and they decrease inflammation. So if you look at these four processes that are triggered by more exercise and movement, it's really neat because it's almost like having 4 pharmaceutical drugs in one, right? So it's the natural opioid, the natural medical marijuana, the natural antidepressant, and the natural anti-inflammatory like Advil. So you can get all of those benefits without having all the side effects and other issues that come with that. And all of these things have to be cleared with your own physician to see, what you're capable of and what's safe for you. But it doesn't have to be formal exercise always. It could be things like household chores, like vacuuming, mopping. It could be fun things like dancing, just going for a walk at whatever pace works for you. And then there's some more intense activities that are helpful as well. So staying with movement, there was another study in JAMA, which again is a very reputable journal, that talked about steps. And you may have heard that, get your steps in, 10,000 steps. And, more activity is good, But for some people, it doesn't need to be 10,000, and some steps are always better than limited steps. In this study, they found in a group of older women, even 4,400 steps led to decreased mortality, decreased death rates. So it helps with pain, it helps with inflammation, it helps with overall disease. So just trying to be more active, even if it's not formal exercise, can be beneficial. Here's a little diagram we put together here, and you can do formal activities, or you can just sort of do activities throughout the day in different position changes. So let's say you exercise for half an hour, but the other 23 hours and a half, you just sit, right? So that kind of isn't the optimal situation. You don't get the best benefits out of that. So ways to improvise is you could set an alarm on your phone if you're working on the computer, whether for recreational use or for work, where you just get up every hour, just do some shoulder shrugs, neck rolls, a couple stretches, go to the bathroom, get a glass of water. That can help break up your position. It can help decrease neck strain, back strain, and joint strain from just being stiff in one spot. You can also try to use the steps more if you're able to. You can consider a sit to stand desk, try to park further away. And it's really investment in you and investment in your own health and well-being. We're still talking about movement. Another study that came out recently talks about maybe timing of movement may make a difference. There's some studies that support timing it with your circadian rhythm. So the body has a natural cyclical rhythm that's on a 24-hour period about, and it's based on sun and nighttime, so daylight triggers it. And so they found that exercise timing is best in the morning or late afternoon, and that corresponds with the cortisol, which is our stress hormone, peak and fall. And it also helps with the melatonin rise and fall. So in this little diagram here, which is kind of fun, the black one here is the cortisol, and you want that to be high in the morning so you're alert, awake, and can participate in your day. And then you want to slowly drop off in the afternoon. So you want to get your exercise in while it's still kind of an upswing before it hits that low point, if possible. And obviously there's exceptions for shift workers, and that's something we work on in our program too, to get like a customized plan for you. The red one is the melatonin, and you want to be kind of low in the day and then peak at night. So your activities and food and exercise all impact this. And cortisol, again, can drive stress. And if you're having a lot of stress, whether it's food, whether it's activities, whether it's relationships, whether it's pain, and this is peaking and staying up, that's going to impact your sleep, which is then going to impact your recovery. So they all really, connect. Sort of touching on sleep, if you sleep better, you feel better and you recover better. So the goal is 7 to 8 hours of sleep for less inflammation and pain. Sometimes it helps to have a relaxation routine. For a lot of us, our children have like a bedtime routine, right? Or it may be, bath time, brushing, story time, and that sort of sets their mind and gets a routine going in their head that this is their wind down time. Now it's time to relax. And that can work for adults too. And I'm not saying you all need a bath and your stuffed animal, but just something you do regularly that sort of signals to your mind and body that you're going to de-stress and sort of calm down can really help with sleep. You can build what people call a sleep cave, which is just kind of like a cooler room, sort of cool enough that you want to snuggle under blankets, kind of darker with not a lot of overhead light at night, but more just desk lamps. And really try to avoid screens at bedtime. And the experts recommend 2 hours before bedtime. That's not really realistic in my opinion. I'd recommend if you could at least do 30 minutes before bedtime without screens. You could do a mindfulness activity. You could talk with someone else on the phone or in person. You could read. You could do a gratitude practice. There's a lot of things you could do with that time, but that really helps kind of decrease the cortisol and sort of keep your stress level low so that you can have better sleep and hopefully a better recovery. Getting into stress and resiliency. So with the pandemic and everything that's going on, it's kind of a hot topic. There's so much data. I mean, I could list studies and studies about how mindfulness-based stress reduction helps with orthopedic pain and inflammation. This is just one example of a study that looked at 30 randomized controlled studies, and they found that mindfulness and meditation help decrease pain, decrease depression, and improve quality of life. And there's a lot of apps, there's a lot of ways to help. A lot of them are free that can be helpful. But it doesn't have to be a formal practice. And I really think that's important to say. Mindfulness kind of can feel foreign or different for some people. And it's really just being present and mindful in an activity you're doing. So like I put in the bottom, you could just mindfully eat. You could just be present with what you're doing eating in terms of the way the food feels in your mouth, thinking about the flavors, and not be reading or watching TV or talking to someone, and just sort of be present, engaged. You could do mindful walking, mindful listening, and talking as well. just as an example here, I like this picture. So are we more like what we perceive the dog to be like, kind of present? Or are we sort of more like the person on the left here who's thinking about everything that happened or everything that has to happen and is not present? So even right now in this room, are you kind of aware of the temperature, of who's with you, of your surroundings, of how your body's positioned? Or you're sort of thinking about what you have to do after this or what you did yesterday and, things like that. It's if you can be in the moment, that really calms your overall stress, and that can definitely, in fact, impact inflammation and pain. So well-being. So this is kind of like a nebulous term that's thrown around a lot. This is a CDC definition, which, it has its pros and cons, but they talk about positive emotions, an absence of negative emotions. And right off the bat, this isn't quite right? So everyone has ups and downs. Everyone has what they consider positive and negative emotions. It's more sort of being present with that and leaning towards more uplifting feelings in general, feeling satisfied with life, kind of feeling like you're moving forward, and generally that things are good. And a big part is this bottom one is feeling connected and supported with your community, with your friends, with your family, with your work partners, whatever your social circle is, and really feeling engaged in life with a sense of direction. So that's really what defines well-being, and because the term's used a lot. So this is a fun exercise. I actually did this when I gave a talk like this at Google. List things that will make you happy and increase well-being. So there's a lot of data behind this. There's a researcher, Sonia Libersky, who does a lot with this. And it's funny, if you ask people, if you were in a different setting, I kind of have you call out, but what do you think will make you happy? And unfortunately, society sort of conditioned us to believe it's sort of typical work-related things, maybe a new romance, more helpful family, being thinner, younger, or more attractive. If you could sort of disappear, get rid of a disability or illness, more money, more time. So this is kind of what the bubble or the word cloud looks like for things that we're typically sort of thought to think will help us feel better and increase our sense of well-being. But the data actually shows it's a little bit different. It's spending time with friends and family who are supportive. It's being easy to recognize that you have some gifts and blessings in your life. So having some gratitude. It's being willing to help others. And there's a lot of data on this. Pro-social acts, helping other people, it really helps your own wellness. Envisioning future, so having some optimism and not kind of blind optimism, but just sort of a feeling that things will eventually work out, maybe with a little help. Being more present, like we talked about, and really enjoying or savoring joyful moments, and exercising, right? Moving more, like we talked about, and kind of having a direction or sense of purpose. I like this story, sort of this analogy about a physical therapist, right? So there's a physical therapist and he or she is working with a patient and they're working on leg exercises. So you ask 3 different therapists what they're doing and they each have a similar patient. And the first therapist might say, oh, well, I'm getting her legs stronger, which is fine. I mean, that's accurate. The second therapist might say, I'm helping her get stronger so she can walk better. So that's even better. So they're sort of feeling like their work has a little more purpose or meaning to it. And the third person says, I'm helping her leg get stronger so she can dance at her daughter's wedding, right? So that last therapist feels like their work or their job is more meaningful and purposeful. And that's going to give them a better sense of well-being and help reduce their stress and inflammation. So it's sort of that, like sort of seeing what you're doing is impacting, especially helping other people. Good coping skills, which is always important. So this is what the bubble kind of looks like for ways that help your well-being that are actually sort of scientifically proven. So this is kind of a lot, and I don't expect anyone to suddenly do all these things or drop their schedule and then suddenly do this, but if you can adopt a couple here and there, even little 5-minute practices, this can be helpful. There's a lot of data about being outside and doing time, just walking outside. There's a Japanese practice called forest bathing, where you just literally go outside and you're mindful. Helping other people, the gratitude practice like we talked about. One of my favorite gratitude practices is the simple 3, which is like a noun. So it's a person, place, and thing. At the end of the day or in the middle of the day, if you can just think about a person, place, and thing you're thankful for, that kind of like brings you out of your stress level and pulls you into a good feeling. So that can be helpful. There's a study on something called an all walk, where people were actually told to go on a 15-minute walk and take selfies of themselves. And they found that those who were told to look for something awe-inspiring and take pictures felt better after the walk and even weeks after the study, as opposed to people who were told to just go on the walk and take a picture. And interestingly, they actually found that their smile got bigger in the selfies and that the picture was less of them. So it became more like this, and it was more of the awesome thing behind them. And the awesome thing could literally be a flower, a sunny sky. It doesn't have to be earth shattering. So adding a little bit of joy each day can improve well-being, which helps with stress, inflammation, and eventually pain. So sometimes we don't have time for big things. So a sneaky way, kind of an easy way to do this is to trigger the relaxation response. This is the opposite of the stress response, right? So the sympathetic stress response gets us fired up. It's cortisol, we're tight, our muscles are tight, we feel small, we can't move. The relaxation response is the parasympathetic response, and it relaxes us. It lowers heart rate, blood pressure, it slows down breathing, and it loosens muscles. So it really just involves taking a couple breaths with a longer exhale. And one of my favorite exercises is 3 deep teenage sighs. So if you hark and think back to your teenage years, it's really doing this, and I'm just going to do it here. It's a nice inhale and a longer, dramatic, audible exhale. So it's and if you do that, which I hope you did, but if you do it later, you'll see your body just kind of relaxes, kind of loosens up, and it does activate your parasympathetic system, which reduces inflammation. So if you can't get out and do a walk and do other things, you kind of feel like you're getting wound up and your muscles and your whole body's tightening up, you can sort of use this exercise as a way to decrease that stress and hopefully stop that, spiral. So, these are the factors. We talked about a lot of them. Again, this is a big overview. If you come into the office, I'd go through personally and personalize all of these for you, but food, movement, sleep, stress, and how some relationships impact inflammation and pain. And what we're doing with the Orthopedic Integrative Health Center is, you come in with an orthopedic diagnosis from your orthopedic doctor, physical medicine rehab doctor, or sports medicine doctor, and we go through these factors. We go through the nutrition, the stress, the sleep, the activity, and how they affect you and how they impact you and how we can decrease inflammation and pain in your situation, and also hopefully prevent some in the future. So it's really an investment, in sort of your health. This is a summary, right? Because we're talking about tips today of everything we sort of talked about, kind of an overview of it, I should say. So you want to do that anti-inflammatory Mediterranean diet, high in phytonutrients and fiber, and omega-3s, less processed food, less sugar. And you can think about intermittent fasting, and that's something individual that you'd have to talk with your physician about as well. More movement, right? And not just walking for half an hour a day, but sort of little bursts of movement throughout the day, especially if you're on the computer. Stress reduction. So we talked about mindfulness, whether it's formal or not, adding a little bit of joy to your day, trying to trigger your relaxation response, your parasympathetic response to reduce inflammation and stress. I call them micro boosts. So they're little bits of joy, little activities really you can do throughout the day to help with your inflammation and pain. So you may want to try once a week, swap out a plant protein meal instead of a meat protein meal and see how that works. Increase your omega-3s, try to limit added sugar, work with an eating window or time restricted eating. Try to increase your daily steps to what's tolerable, even spaced out throughout the day. Just more movement, try to make it social and take it outside because that's always helpful. Consider exercise timing. In terms of sleep, sort of have that wind down or relaxation routine, make sleep a priority, build a sleep cave, and try to avoid screens for at least 30 minutes if you can before bedtime. For stress, we talked about something like an all walk or nature walk, the mindfulness activity, adding some joy to your day, and triggering that relaxation response. So these are our objectives to talk about the what, why, and how. So factors that impact orthopedic recovery and health, how to lower pain and inflammation, and why it matters. This is our new program, really, the Orthopedic Integrative Health Center, and it builds a customized what, why, and how for you. It's about prevention, so even if you don't have injury, it's about pain control. And we can develop a preoperative and postoperative plan for you as well. And that's the majority of the patients I've seen so far have been postoperative, some a couple months, some a couple years. These are some of the factors we go through, and they're based on the American Academy of Orthopedic Surgeons protocols and evidence. We would go through some of these factors and talk about how this can actually help reduce complications like infection, poor wound healing, blood clots, and blood sugar issues. And again, this is sort of the missing puzzle piece, right, in orthopedic care. It's pulling it all together, still working with your orthopedic doctor, your primary doctor, but optimizing your care for the best recovery and for prevention. So it's really your personalized how. And, you know, really want to empower you to build your own health and take care of wellness, try to limit use of opioids best we can, and if needed, develop a surgical plan. This is our number. This is our website. We also have Instagram for Rothman, and I have my own as well if you want any wellness tips. And I think with that, I will turn it over to Casey.
Great. Thank you, Dr. Sharma. You gave a lot of fantastic information here, a lot that we can really take home. And I probably will be sending this presentation to a lot of my family members. So I appreciate it. For all of you listening, I spoke about it in her introduction that the orthopedic, she is the medical director for the Orthopedic Integrative Health Center. She sees patients. She is a Rothman physician, but she is the medical director for this particular service line. So that is why we have a separate phone number to schedule an appointment. And that is 484-381-4305. And I'll type that again in the chat box. We do have a bunch of questions coming in. There's a little Q&A dialogue box at the bottom of your screen. You can type them in there. However, don't get too personal. We'll probably have to skip those, and we'll do our best to cover as many as we can. A good one that came up, Dr. Sharma, if your diet has not historically been ideal, will changing it at the age of 60 help your level of inflammation?
Yeah, and that's, you know, that's a fantastic question, right? And the answer is yes. I mean, it's where you are here and now. We can move forward. She's not part of this talk today, but Phyllis is our dietitian in the program, and she can come up with a great anti-inflammatory program. But yeah, the changes you make now can definitely impact your health now and in the future.
And just one other tidbit about the Orthopedic Integrative Health Center. This is located out of our Bryn Mawr office for the initial visit. Somebody did ask if this is covered by insurance. Do you want to speak on that?
Sure. So at this point, it's not. We would love to get there at some point. But I spend 45 minutes one-on-one with whoever comes in. And so it is out of pocket. The patient navigator can help you sort out the details of that. And Phyllis, the nutritionist, her piece may or may not be covered. Some insurances cover that. But our goal is not to be in the confines of insurance, but to really work with what you need and have the time and space to take care of your needs.
Great. Somebody asked, what is guided meditation? So
there's guided visualization. Maybe that's similar to guided meditation. There's online resources like Kaiser has some on their website for free, the Kaiser Health Group, but it's basically where, you know, you kind of close your eyes and someone sets the scene, and it's supposed to be a relaxing scene. So for example, if someone likes the beach, you would have someone close their eyes and say, okay, imagine you're laying on the beach. You hear the waves back and forth, back and forth. You feel the sun on your face, you feel the sand in your toes. And it's sort of like a de-stress, relaxation kind of activity, which again would help with inflammation and stress.
Okay. Does CBD help with joint and inflammation?
It can. So there's different kinds of CBD, right? So there's the hemp base, which is over the counter, and then there's the medical marijuana base. You actually have to have a license and be certified by a physician. One of my colleagues here at the Bryn Mawr office, Dr. Grice, does that. But it can help with inflammation. They're still doing a lot of studies on that, but it can.
What is your view on the use of supplements to support joints, like glucosamine, chondroitin, collagen?
So the data is, you know, mixed on that in terms of the research studies. If you don't have side effects, I don't think it's harmful. Some people sort of swear by it. You know, if you were coming for a visit with me, we'd sort of go through more evidence-based supplements that help with pain and inflammation. For example, omega-3s or turmeric, even some magnesium, things like that can help. It really depends on what your individual need is. But I don't think, if you don't really have side effects, I don't think it'll hurt you to take that type of supplement.
Will does this program include acupuncture or any of the new infusion therapy for regenerative medicine?
So I'm actually an acupuncturist as well. And I do some acupuncture, Rothman, not a lot, just based on our schedule. But that, is something we can offer. It's not included in terms of like a package here, but we do have that. In terms of regenerative medicine, some of my colleagues do the PRP, the platelet-rich plasma injections, and prolotherapy. Those are the sports medicine docs. So some of them do that under ultrasound guidance.
Any of the tips that you discussed today, will any of that help spinal stenosis?
Yeah, so that's actually I'm mainly a spine doctor, a non-operative spine doctor. So that's my main focus. And yes, it can. Now it's to a degree, right? So we're not trying to say that these are cures. These are ways to help lower pain and inflammation so you can function better. So the answer is yes, they can definitely help with some of the inflammation with that.
And working with you, would you be able to give any tips on how to avoid anxiety? I get a twinge or a sore doing something, and it reminds me of bad episodes when I got my back locked up and I was useless for a few days at a time. So would that be something you work with?
So it is. I want to be clear, I'm not a psychiatrist or psychologist, but I can definitely help with that. Sort of that reminder, that stress feeling, besides the quick teenage sigh thing, which was kind of just for fun that I did. There's some other evidence-based breathing exercises and even some mindfulness things we could do that will sort of pull you out when you feel that twinge. Okay, this is what I do now. Sometimes we actually have people make like a little bag, I call them refresh anchors, of things that bring them sort of calmness or joy. It could be like a souvenir, it could be a picture of a loved one, something that'll just ground you and pull you out of that moment. So that's something we could work on for sure.
A few people have asked questions about shoulder issues, not to get too specific. So any suggestions on pain relief or exercises while waiting for injections, or is this like a program that we should be going through prior to surgery?
So yeah, okay, there's like a couple questions.
Yeah.
No, that's okay. So in terms of shoulder pain, yes, these can help with shoulder inflammation and pain. Some of the things we talked about, these lifestyle and integrative changes. If you're kind of in limbo waiting for something, sometimes we'll recommend over the counter like topical lidocaine patches and Voltaren gel and stuff like that. In terms of if you're getting set up for surgery, we can build a whole operative plan for you. Really optimize your risk factors and help develop a better recovery for you so you get better sooner. And that's definitely something this program can do for you. And if that was the case, I'd probably recommend meeting with me before surgery so we could have a plan for your nutrition and exercise before, even right after surgery when you, are recovering that day, and afterwards. I think that would work the best.
Okay. Two more questions for you. A 67-year-old male runs 2 or 3 times a week for years, takes triple action joint. This is getting specific, but he really wants to know. So I want to ask: still sore and inflammation and long recovery. Any suggestions on top of that when to get the
Where's the pain? Sorry, in case I missed it. Or just
he drinks a lot of water, 8 hours of sleep, still has soreness and inflammation and long recovery days. He didn't say specifically. I'm assuming lower extremities, since that's what the talk is.
Yeah. So it would also be, the stretching routine and the ergonomics before and after can be an impact. And we have some great physical therapists who are covered by insurance. You could see here too for that. And it will sort of be what you're doing the other times too that you're not running, right? So that's a big piece of it, how active and how mobile you are the other times. And it may be modifying the running. It may be doing more track as opposed to road running, or maybe doing more treadmill, or maybe mixing up the running and alternating it with other exercises and just doing running once a week, but still getting it in. So, it sort of depends on the individual factors.
Okay. And then a few people want to know price for a 45-minute consult. What can we offer them?
I think the best thing to do is call the number and talk with the navigator. That's more on their end, or the website. Yeah.
Okay. All right. So again, to get all the details specific for you, because this is a very niche VIP, like we want to consult. We want to create something specific for you. The number is 484-381-4305. And again, I'm going to type it right here in the chat box if you want to go to the website, and I will email this out afterwards when I send the link to the presentation. So
I have it on the screen too. I don't know if my screen's still up, but it's on the screen too.
yeah, so perfect. So again, I will follow up with the email with everybody, and I appreciate Dr. Sharma, you taking the time to go over this information. You gave us a lot of good information. And then I will follow up with everybody. Thank you for being here and have a wonderful day. Thank you.
Thank you. Good luck, everyone. Have a great day.